So yeah, I'm going to today be talking about two modules that I wrote for GISF on for their series on keeping up with COVID-19. And specifically, these talk about acceptance as a security strategy during the pandemic, and also working with partners and the broader localization agenda. So, as I'm sure all of you have experienced and know too well, now COVID-19 has brought about quite a lot of changes within the aid sector and more generally. So we've seen a change in the operating environment with new regulations and travel and movement restrictions imposed over different countries in different ways and at different times. We've seen also the politicization of the pandemic in a lot of the countries in which aid workers work. And of course, this has resulted in new and heightened security risks and threats, making really low risk settings suddenly, high risk settings, and making high risk settings even more complicated to operate in. So we've seen changes in patterns of crime, with some contexts seeing a reduction and others seeing a rise, notably South Sudan. We've seen examples of xenophobia. We've seen examples of what the UN has termed the shadow pandemic, so a rise in gender-based violence and domestic violence. We've seen civil unrest with protests against lockdown, but also because of exacerbating tensions, because the pandemic has exacerbated existing tensions between populations and governments as well. And we've also seen, of course, examples of extrajudicial killings by police who are trying to enforce government restrictions due to COVID. And this changing operating environment has changed the way organizations work and with whom they work in a lot of contexts, with implications for the relationships that they have and also the acceptance that they may be used to have from these different stakeholders. Notably, we've seen a greater reliance on national staff and local organizations when travel and movement restrictions were quite high. We've seen a shift to online and remote working with challenges and opportunities that has brought. There have been new programs introduced to respond to COVID-19 needs, but also because of the new regulations, some programs have had to close or they've had to change, with implications about how organizations have been perceived by beneficiary communities and others. Some organizations also have seen a greater engagement with private sector actors, with government actors, and we've noticed also a rise in the role of military personnel in the enforcement or even the provision of COVID-19 response measures. And I think the COVID-19 pandemic has also highlighted the central role that communities play in epidemic response. And I think this isn't a new learning. We've seen this from other epidemics, notably Ebola, that epidemics cannot be contained without community buy-in. So you can have a vaccine, but if nobody takes it, then you're kind of stuck. But another finding that COVID-19 has shown is that community members are increasingly becoming the main perpetrators of violence against aid workers. And I'll talk a little bit about that in my next slide. And of course, something that we're all very familiar with is this proliferation of disinformation and misinformation on social media, especially, and other communication channels, which has increased security risks to aid workers. And the example that I've been told multiple times is the UN bringing COVID-19 to South Sudan early on in the pandemic, but also this risk that it poses to increased transmission. So the IFRC has been collecting information on perceptions of community local populations on the African continent. And one of the things that they heard repeatedly was that COVID-19 does not kill Black people, with obviously implications for how people will react to COVID-19 response measures. So what does the data say? The aid worker security database for 2020 recorded the worst year for the second year in a row in terms of aid worker insecurity. So there were 282 incidents affecting 484 individuals, and 95% of those were national aid workers. So you can see that it was surprising for some of us who thought that with restrictions in travel and movement, you'd have fewer security incidents. But in fact, that wasn't the case. And maybe understandably, the majority of those incidents were affecting national aid workers. Insecurity Insight has provided another additional analysis tool from the data that they've been recording. So they've been looking at attacks against healthcare workers related to COVID-19 and recorded 412 attacks. And as I mentioned earlier, this role of communities and civilians in terms of aid worker security, they found that 83 of those perpetrators were civilians themselves. And this is also something that ICRC have reported seeing in their own incident tracking. So the numbers of incidents attributed to civilians is on the rise for them, increasing by 50% over the last 3 years. So in terms of acceptance, as many of you are security people, I'm sure this is not anything new to you, but for those who don't know, acceptance is a security strategy and it requires building and maintaining relationships. If done well, it can reduce or remove potential threats and improve security and access. But it needs to be built proactively, it needs to be measured, and it needs to be monitored. And in practice, this doesn't always happen. In fact, as I'm sure everyone knows, a lot of humanitarian actors often assume acceptance by virtue of their intentions or their mandate, and this in practice doesn't hold. And acceptance really can be seen as a continuum. So from accepted to tolerated to rejected, you might find yourself in any of these. And even in the same context, you might be tolerated by the community, but you might be rejected by a local armed group. So in terms of recommendations about what that means during the pandemic, it's just to be expecting an ever-changing environment. Like we mentioned, to be constantly analyzing the risks, the context, how they change, how the relationships are changing, and how those changes are affecting your organization's acceptance. It's also about adopting an organizational approach to acceptance. So not only to consider the safety and health risks that COVID-19 presents, which might be a different function altogether in your organization, but to also see how those measures might be affecting acceptance and to make sure that those two functions are talking to each other. So security and health and safety folks. And I think a really big learning, and this is something that we've seen also in other epidemics, is this need to meet community expectations. So an NGO that I was speaking to, for example, was saying that COVID-19 isn't being taken seriously. It's not a priority for a lot of the communities that they work with. And so going in and talking about wearing masks is not really working well for them. So what they've done instead is they've had those two-way communication, understood this isn't a priority for them, and created a program that did meet that priority need and those expectations, but then added on COVID-19 activities to it. So bringing in hand sanitizers as well. And they found that that add-on worked well to manage those expectations in a way that worked. You also have to manage disinformation and misinformation proactively. And a good example of that is the IFRC, for example. It has taken active action to be on social media, on Facebook, and actively responding to questions, to misinformation about COVID-19 or their activities. And that seems to be working for them. And also this aspect of monitoring and measuring acceptance, which I know is a challenge within the sector, but GISF recently published an article by ACF, and they had a very interesting tool that they presented in that article about how they're trying to more formally monitor and measure acceptance within the organization. And I highly recommend you take a look at that. Of course, it's also about assessing partnerships and coordination. So what does it mean if you have more military actors suddenly in a context responding to COVID? What does that mean for your organization and its acceptance? And also adopting common rules of engagement, of course. If you have more military actors and you have, for example, the WHO present, suddenly working more closely with them because of their mandate and because of the needs to respond to COVID. What does that mean for you, and how are you painted then as a response actor who might be perceived as the same or affiliated with that? But I think COVID-19 has also brought in this internal acceptance issue, which is you have vaccine hesitancy among staff, understandably. You will have local and national staff members have a greater expectation to go out in the field, to potentially take on more risk, and that might cause resentment. You might have international staff members who have better access to vaccines, which could also cause resentment. So it's also be aware of that internal acceptance and to just be aware of it and to devise plans to address it. And of course, just to say, acceptance, of course, is just one of many of those three security strategies, and to maybe consider the others and to potentially use a blended approach. So working with partners in the localization agenda, all of what I spoke about earlier has affected partnerships within the aid sector. There are many who are arguing that COVID-19 has accelerated the localization agenda to some extent because of this greater reliance on local partners, especially at the beginning of the pandemic, and how, of course, this greater reliance has increased their exposure to risk. And that's true in many cases, that has happened, but it hasn't really resulted in a true shift in power. And it also hasn't really been accompanied by strategic conversations about the risks that come with that greater responsibility. And that reflects what GISF's research has shown in the past as well. But COVID-19 also presents an opportunity to this greater reliance to turn it into a proper advancement in the localization agenda, and to do it in a responsible way. So in terms of good practice, this might be familiar to anyone who's read the GISF guide from this year on local partners, but it holds true also in the pandemic. It's about making sure that conversations are taking place about risk transfer and what risk sharing really should look like within a partnership. It's about walking the talk of partnership principles. It's about communicating and building trust. And in COVID-19, that might be more challenging given the online working and remote working that has been taking place, and to also discuss risk attitudes and how those might differ between the partners. So once you've done those foundational conversations, to then also be looking more strategically at the partnership itself. What are the risks that are the concerns of each partner, and how can they work together to mitigate those? And then it's a more specific conversation about different projects. So identifying what the security risk management needs are and the gaps and challenges, maybe doing a joint risk assessment, and if you have identified then risk mitigation measures to make sure that there's funding attached to it. To also strengthen capacity within the partnership if that's something that's identified by both partners as a need. And also to engage in this joint advocacy, because a lot of the localization agenda is out of the power of one individual organization, but with more voices joined together to advocate for change. And one example that has been mentioned to me multiple times is this issue of donors not providing sufficient funding to provide overhead costs to local partner organizations as well, so that they can't really put in place risk management measures that they need to put in place. And so maybe engaging in joint advocacy with donors to make sure that that funding is made available to local partners is an opportunity. During COVID-19, there were several examples and opportunities related to this. One interviewee I spoke to, he said that the most successful programs during the pandemic that he saw were more flexible approaches to work plans and budgets, and to really put operational decision-making at the most local level, and that really worked well for them. Another example was a local partner organization was sharing weekly updates with their international partners on COVID-19 situation in the areas where they were working. I've also seen examples of international partners sharing resources to ensure staff safety. So for example, PPE. Another international partner I spoke to had developed clinics with inviting their local partners to share and exchange knowledge about security risks and challenges. And for example, they brought in some experts to talk about particular topics, and they also brought in a health specialist to talk about COVID-19. Interestingly enough, another interview I spoke to said that with the greater reliance on local and national staff and local partners, government officials were suddenly not negotiating with internationals anymore. They were negotiating with national staff. And that actually that improved acceptance a lot by having that change in visibility. And that's something to maybe learn from moving forward. Another interviewee said that a lot of money hasn't been spent in budgets because of no international travel, lack of need to accommodate those staff who haven't been traveling, and to use those unspent funds maybe in a creative way to potentially address gaps in security risk management for local partners, and to talk to donors about doing that. And I know that security focal points also really struggle sometimes internally within their organizations to raise this issue about local partner risks. And I think the pandemic has provided an opportunity to maybe help bridge those gaps, to raise those concerns with staff internally who might otherwise not have really been very engaged or interested. Unfortunately, the general sense I got was that even though some progress was made and some flexibility in budgets and work plans was introduced following the pandemic, now as things are stabilizing, things are going back to the way they were. So there's more of a top-down approach to partnerships. And so I think there's a big risk that things will go back to the way they were, which is of course not a very responsible way to partner. So I think there's a genuine need to build on the momentum and the lessons learned from the pandemic, what is possible given the restrictions, and to not to lose that and to continue moving forward in the direction we've been going. That's a brief overview of those two modules, and I'm sorry I ran over time, but they have been published. So if you'd like to learn more, have examples, they're on the GISF website. Thank you very much.
Thank you, Adelicia. We're gonna open the floor if there's any quick questions for Adelicia. I'll give it a moment, but we'll have a chance to follow up with any additional questions afterwards. Any quick questions for Adelicia? We're going to hand it over to James Davis, again, the Director of Safeguarding and Security for Women International, who's going to share a little bit of perspectives on his module that he worked on for the COVID series. Thanks, James.
Yeah, good afternoon all. Megan, if you want to throw up the presentation. Great, okay. So just the preface I always give when I speak about digital security is that I'm not an IT guy. I'm not technically savvy. My knowledge around digital security, it mostly comes from the fact that, like all of us doing the job of security risk managers, we've had to expand our horizons significantly over the past couple of years. And you can't be afraid to consider digital security as part of the normal process of considering risk in any aid organization. It's not just an IT issue, it is everything and everything we do. And so we're going to talk about digital security and how in a COVID world, we've made some changes or accelerated some changes. And also, as Adelicia was just saying, some of the post-COVID world, which hopefully we'll reach someday. All right, Megan. So one thing we know is that the onset of the global pandemic has only accelerated the digitization of the aid sector. For those who've attended any GISF forums where we've had sort of forward predictions of challenges coming up, one of the things that always struck me, one of the things that really initially got me interested in this was the awareness that increasingly our sector is moving into the digital realm. Our ways of working are increasingly digitized, our record keeping, our collecting of data, All is going much, much more into the digital realm. And there are risks that come along with that. And I think it was made quite clear that as a sector, we see IT as this little corner, these guys in some corner of the office doing their little stuff on their laptops. But it doesn't sit there anymore. It sits with all of us. So in the module, I'm not going to go through specific parts of the module, but I'm going to kind of highlight why this is important. And I'll do a quick summary of the actual module, but hopefully you can have a chance to read it when it comes up online as part of the package. But some of the things we need to be thinking about are software and hardware, those technical things we use every day. So there's a lot of new apps in use, and you'll find staff around the world will always be trying out new apps. We bring in new types of software all the time to make our work more efficient. We've all changed multiple platforms in our organizations in recent years to become more effective. We hear the next new thing, and we're always getting on board. Interestingly, especially for apps, because a lot of our staff do work through their phones, there's not any real regulations about apps. Anyone can create one. There's a lot of fake apps out there. They look legitimate, and really they're just an access point to gain access to your system. And people will say, well, it doesn't really matter if someone's phone has a fake app on it. Well, people exchange documents, they read their emails, they log in through their phones. So if you have an access point through a phone, that's one way into your organizational system. Another interesting thing that a lot of us really don't pay any attention to is the fine print. So I've used this example before for those who haven't heard it, but early on in the pandemic, a couple of organizations were asking me about, because they're having so many online meetings, they wanted software that would automatically, using voice recognition, create a text review that they could use as minutes. And they asked me to review a couple to see if there was any sort of security risks. And if you read into the fine print, in virtually every type of software we're using, somewhere down in the fine print, it says that though the actual content of what you're doing might be end-to-end encrypted, if we're talking about video conferencing or a communications platform, but the information like who you're talking to, where they are, how long you talk, how often you talk, what kind of systems do you or services do you use on the platform? Do you share files? Do you exchange videos? Do you put in links to third-party sites? That information is marketable, and all the fine print says that. So if you're using any kind of platform, I suggest you read the fine print, because people can buy that data, and people who are concerned about the type of work you're doing, especially if you're doing advocacy around climate change or gender equality or human rights, you are then basically giving them all the information they need to track what your organization is doing. So third-party fine print is key. Then we have the north-south tech disparities. So just because we have all the fancy systems in Europe and the North, your staff working, good organizations will provide laptops and equipment for staff, but very often on their own personal platforms or in their own time, they can't afford the same software we have. So they're getting pirated versions. And of course, pirated versions have all sorts of openings in them for hackers to get through. They don't get security updates. So again, through that secondary system, you're getting access problems. And then this has been brought up before, algorithm aid. So one of the shifts in our sector is that we're actually moving away from humans really understanding the data. We get software which crunches numbers, you pack that in one side and it spits out results on the other. Donors look at this kind of thing to kind of track long-term impact of aid they're funding, and it's algorithms. And the algorithms are created by the software companies that we use to create all this stuff. And if that doesn't concern you, I think you probably should think again. So then we have all the new shared online work platforms that we all use, Teams, Google Docs, cloud-based sharing. And there's questions that come to me now because I've been doing a few of these digital things and sort of seminars and briefings and at the forums, and people actually send their questions to me. Interestingly, things like Google Docs. So one organization got in a lot of trouble with a Google Docs and a shared work platform where the person who actually had set it all up was fired for some sort of infraction from their organization, but they had ownership of the group. And the group still had a name and it was still pumping out information and other people were getting access to it. And the other members of that group couldn't get control of it. And that's because have you ever tried actually contacting Google for a helpline, or Facebook, or any other big platform? There is no such thing. You cannot contact them. You can get to fact pages, you can get to other external support services, but you can't get control of things within Google Docs. And so you have to really look at, can you contact Microsoft Teams if you're having a security issue with something? Extremely difficult. So there's all sorts of issues around our shared work platforms that you're really going to need to look at. Video conferencing, obviously our whole world has changed around video conferencing, and it's a constant struggle. We all know Zoom in the early days, it was getting Zoom bombed. People were breaking into meetings, and we see all the time updates around security, whether you're using Teams, whether you're using Zoom, still using Skype, Adobe Connect, whichever platform you're using. And it's kind of a race between the hackers and the security departments of these organizations. And we'll get a security update, but then that'll get broken. And so there is some real challenges around that. We all hear stories of if you have a Zoom group or WhatsApp group or anything like that, you can get external people coming in. You can get people creating groups that sound legit that suddenly you're invited to and you join. And going along with video conferencing, we have disruptors. So if you're not so much internally, but a lot of webinars like this, a lot of conferencing that we used to do in person are happening online. And there are people who are disruptors. They're either working for a state that doesn't like your agenda, they're working for some kind of political action committee, as Adelicia was saying, doesn't like what you're saying, and they're disruptors, and they'll get into your call. They sound like they're coming from legitimate organizations, and they're just there to disrupt. You get third-party data collections we already talked about, and supporting software. And this is kind of just a really quick, interesting story. I was just in Amman, Jordan, a couple of months ago, running a training, and I was sitting in my hotel, and I'm Skype running in the background, and I was in a restaurant very late in the evening, and there was only 4 people in the restaurant. There was the waiter, there was 2 people sort of standing at a bar at the other end of the room, about 25 meters away, and it was me sitting at the far end of the room. And I didn't know Skype actually has a function where it started picking up their conversation 25 meters away and giving me an English translation scrolling across the bottom of my screen, which was both interesting to hear what they were talking about, but actually a bit disconcerting that a platform like Skype is going to be doing this. So if Skype is doing it inadvertently, you can imagine the other types of software out there that are monitoring what we're doing and saying. And then finally, one of the other big kind of shifts around COVID was we don't raise money or awareness by putting people in train stations or airports with signs or buckets handing out things or taking donations anymore. Everything we do is online. All of our campaigns, our advocacy work, our fundraising is all online. And that presents challenges. We have things like honeypotting. Now, honeypotting is an odd term, for those of you who don't know it. It actually refers to organizations that create traps online for hackers to lure them in with some sort of what looks like a reward, but it's actually a way to identify them and find out how they're actually operating. But certain governments have decided, well, that looks like a good idea. So now they're honeypotting the aid sector, especially human rights workers or people working around sexual health, reproductive rights. And they're creating platforms that look entirely legit. You'll be speaking at a conference or something. At the end of the conference, someone will send you an email saying, I heard you speak. This is brilliant. Our organization is working on this. I'd really like to kind of have a chat about this. And there's a whole platform we're using where there's a whole bunch of people doing this, and it's all very legit, and you can join the platform and you meet all sorts of interesting people all working on the same topic. There's nothing negative about it, but it's actually run by a government or an organization that really wants to identify who you are, what your messaging is, who you're contacting. This was actually done recently by the Chinese government for people working on human rights for the Uyghur populations. And they were basically trying to identify who the Uyghurs were that were working with foreign aid groups and how they were communicating. And it's basically a honeypotting operation. And then I won't go into the acceptance challenges too much, but this remote way of working, because Adelicia's just talked about it, has really created, a state of removal from a lot of organizations, from the actual communities we serve. Next slide, Megan. So just a couple of thoughts in general about digital security. I've said this many, many times. For those of you who heard me speak before about digital security, it's kind of a broken record, but forget gold, diamonds, platinum, even cyber currencies. The most valuable commodity in the world is data. And every 48 hours, the total sum of all human knowledge, all of our recorded history, our verbal history, is being added as data points. So it's an exponential growth in data that's out there. Every NGO on the planet has had a data breach. Some of you may be aware that you've had a data breach, some of you may not, but I can pretty much guarantee every one of you so far has had a data breach. Who's looking into it? How is it being managed? What was lost? UN organizations have had major data breaches. Another interesting one is, and this actually was brought up by, a lot of these points actually come from Dr. Lisa Short in Australia, who was part of the HNPW discussion on digital security earlier this year. If you're using a free app, whether it's WhatsApp, Telegram, Signal, Facebook, Skype, if you're not paying for it, you are the product. And remember the third-party marketing info? That's essentially what they are. The companies that create this software don't do it for free. They're making money off the fact that you're using it. So you really got to think hard about using any free apps because you are the product. 60% of the global population is now online, and social media use, not new people joining social media, but people engaging in social media, is increasing by 15.5 million uses per second. So if that's not an impressive sort of fact for you to consider, I would start thinking about that, because everything we do is engaging in social media. And as Adelicia mentioned, disinformation, agenda politics, that's where it's all happening. And just as an aside, I was just reading this morning that the UK government has actually come out with a warning from the intelligence community that the cyber conflict around the use of the internet and what it is for and how it should be engaged with is becoming a major challenge. And you have Russia and China on one side who want to use it for political influencing, for spying, for shifting agendas in the West, also controlling their own populations, is being fought by the West, who's trying to keep it open and this wonderful tool that we can all make use of. And so even on the macro level, this is becoming a big challenge. I have the aid worker security database, same figures in there that Adelicia was showing in the last section, 483 physical attacks on aid workers in 2020, pretty significant. But who's tracking online attacks? There's some figures coming out from the WHO that something like 60% of human rights advocates globally have received death threats and they fear for their lives. 40% of those fear for their families because, of course, the threats are generally about their families and their children. And so we're not really tracking how many people, because we're working remotely more and more often, are actually being threatened online. And I suspect that it's quite a significant number. And then one interesting thing that has come out quite recently is the number of fake fundraising scams that are increasing globally. I believe it was Save the Children got burned not too long ago, where someone created a savethechildren.net website after some global disaster to raise money to help people. And they took in, I don't know, quite a bit of money before somebody at Save the Children noticed and got them shut down. And this is popping up all over the place. So after every global emergency, is someone in your organization checking that someone's not using your name to basically scam people out of donations, which of course you'll be held responsible for in the long run. Megan? So a few recommendations, ways we can work with this. And in the actual module, if you actually don't have a read of it, it picks out some of the more common digital security threats and goes through the risk mitigation process and some recommendations, but just some overall recommendations on digital security. Make digital risk assessments part of your normal risk assessment toolbox. Every department really should be looking at the software they're using, how they're using it, what its vulnerabilities could be. And this was actually kind of interesting. Recently in my new organization, Women for Women in Afghanistan, we all know in Afghanistan, a lot of organizations had a lot of biometric data about beneficiaries and programs. Our organization actually, as the Taliban were taking over, were running out and trying to burn paper records because they realized they had all this data about women who were in programs in Afghanistan sitting on files. Now, digital records they could back up off outside of the country somewhere at headquarters, but physical paper records, they couldn't. And that was part of the digital risk assessment, that nobody was really considering the relationship between digital data and actual, physical paper data. Increase the digital education of your staff. Make them understand what these challenges are, and the fact that it's not just about sending a WhatsApp message or checking the email address and not answering or clicking on that little link to get that invoice that somebody you've never heard of is sending you. It's about everything that we do and how we work. But also, and this was brought up by Professor Short in HBNW, that a lot of the emerging economies in the world, especially the places where we're working, more and more people are getting online every day. But because they're quite new to it, their understanding of digital security and the risks that they present themselves, and this is from a safeguarding protection view as much as anything else, they're not quite as aware. So if you're doing any kind of programming that has any kind of digital component where they're registering for something online, they're receiving cash-based transfers, you need to educate them in digital security as part of the program to meet your duty of care and your do no harm requirements. Use paid services and apps wherever possible so that you don't become the product when your organization and its data doesn't become the product. Read the fine print is a key one. I know it's boring and I know it can put you to sleep, but power up on espressos and read the fine print on all the software that you're using with your organization, because that is key. And you will find vulnerabilities in that software. I've had to do this recently with a lot of external service providers around communications and satellite tracking equipment that our organization was using that I'm not comfortable with. Ensure your organization understands the balance between transparency and protection of data. So this is a big one. In Europe, we have GDPR, but there are different standards around the world. And there's a lot of times, like our organization, burning piles of paper documents where we're kind of wondering, how transparent are we being if we're burning documents before the Taliban get their hands on them? So you have to have a clear understanding. Just like a few years ago, we all sort of had to go to organizations and try to define what our risk appetite was. Now we have to understand what is our duty towards transparency to the communities we work in and their stakeholders and the governments that host us and our donors and all the rest of it. And what is our duty around confidentiality and protection of data that we have, like Afghanistan with all the biometric data that NGOs were holding. And I won't belabor the point, but acceptance is becoming harder and harder. Every step, human-human interaction is removed from aid work. It's all becoming digitized. People are applying for programming to become beneficiaries on programs online. And every time we do that, we take a step back from that human-to-human interaction that is actually what created the aid sector in the first place, humans helping humans in need. And finally, digital equality must be considered. And when I say digital equality, one of the things we noticed early in the COVID pandemic is directors, when everyone had to work from home, who all earn a good salary, live in 5-bedroom homes in the Hamptons, were quite happy to sit around in their underwear or track pants and work from home. Where younger staff who live in a big urban center like London, who had to share an apartment because they couldn't afford to live on their own, who didn't really have a private space to work, wanted to get back into the office. And a lot of organizations are just really hesitant because the people who make those decisions are quite comfortable sitting in their pajamas all day long. And that digital equality becomes key. And if you even consider your staff working in Africa or in Middle East or somewhere in Asia with poor internet, there may be good internet in the office, but do they have the same access at home? But they're still expected to deliver their work. So they end up working longer hours trying to get online to fill out some report that they have to send because they don't have the same equality of their digital access that we do in the northern world or more developed economies. And so you got to kind of consider where everybody's digital status places them, and you must consider digital equality of your staff. Otherwise, you're going to put them in extremely stressful situations. All right, last slide, Megan. So this is just a bit of a joke. I'm sure you've all probably seen this. If you haven't, it's actually worth going to YouTube and just searching "I'm not a cat." This was actually a Zoom call where some lawyer's daughter had been playing around with filters and turned him into a cat in a work call. Now, this is a bit funny. If you actually watch it, you see him speaking as the cat and his eyes are moving and the cat tracks where he's looking. But you can imagine if you can do that just for a bit of fun, what can people really do in Zoom calls and Teams calls and Skype calls and Adobe Connect calls and whatever other platform comes up in the next couple of years in terms of faking people that we think are real that aren't actually the people we think they are. So it's becoming a challenging world out there. The sector is increasingly digitalized, and as security risk managers, you can't just look away. You're going to have to engage in digital security. You're going to have to try to increase your understanding of it. You're going to have to include it in your risk assessment toolbox. Whenever you do any kind of risk assessment, you need to consider the digital impact of how you're going to work and what the risks are going to be around it. And that kind of winds up my component. Thanks, Megan.
Thanks, James, for those very sobering reflections. I know everybody is already Googling or going to YouTube right now, so please don't go away yet. Do stick around. We're going to move on to Scott Ruddick, the Senior Director for Global Security at MEDA, who's going to give us some perspectives on the outlook for COVID-19 for 2022. So thanks for joining us, Scott.
Great, thanks for having me. I'll just share my screen. And if somebody can just give me a heads up that they're seeing that okay?
Looks good.
All right. I'll just get the slideshow going. All right, thanks very much, everybody. So what I'm going to be presenting on today is when I was asked to present on this part of this panel, it was interesting because just back in October, I was asked by the leadership team at MEDA to do a presentation on what the future of COVID looks like and what COVID would really be looking like in 2022. This presentation is going to build off the research that I did for that and talk a little bit about what I think and what we're preparing for as we move in from the pandemic of COVID to the endemic of COVID. At its core, I think important thing to understand is that COVID really is with us permanently. The future of COVID is probably going to look a lot like the flu. I think what we're going to be seeing is the fact that seasonal flu has been with us for decades, an endemic respiratory virus. Widespread circulation means there'll be a level of immunity in most populations. Now, however, despite this immunity, we know that flu infects about 10% of our adult population. And here in Canada, it creates about 5,000 deaths per year and about 30,000 in the US. And I think this is likely what COVID is going to look like for us going forward. And I think it's going to have some impacts for us as security and risk managers that we're going to have to be mindful of and that we're going to have to build in. So I'm going to talk a little bit about some of the research that we've done to take a look at and some of the sources that we've drawn upon and show you what our results were from that and then how we're addressing that as we look at the endemic nature of COVID. Right. Before I begin, I just want to give a source to shout out. One of the unintended, I think, benefits of the COVID, of the pandemic, has been the really good professional sharing from a number of sectors. I think the aid, development, humanitarian sector has been great about sharing their resources, but I've also seen medical researchers, scientists, epidemiologists really stepping up. And I think it's important to note that there's a lot of really good information out. I want to give a source's shout out. One of the sources that I use pretty regularly is Dr. Trevor Bedford. His research and some of the stuff that he's posted online is reflected in the presentation I'm going to give here. He's a scientist at the Fred Hutch Center. He's one of my go-tos for information and for data on COVID. And if you aren't following Dr. Bedford on Twitter or you're not engaging him on social media, highly recommend it. Clear, concise, very clear analysis. And we draw upon, and this presentation draws upon some of the research that he's done. So when we're talking about the endemic nature of COVID going from being a pandemic to endemic, that's really what we say is when more or less the entire population has got some level of immunity to the virus, like we see with the flu. It'll be achieved, though, at different times and in different locales due to inequities in vaccine distribution, vaccine hesitancy, and the public health measures. And I think what will be important as we go into 2022 is to think about that shift from the pandemic into an endemic state as really kind of a soft transition, not a sudden flip of the switch. I would say that the 4 factors that we need to watch, and we as risk and security managers need to watch to get a sense of if a locale is shifting from more of a pandemic to more of an endemic state. One is the reproductive rate, how the infection is passed along to others. Immunity degradation. As we're seeing with the current Omicron variant, this has become an issue, is that some of the vaccine efficacy has been impacted by the mutation of that particular virus. So you're going to see greater infection rate, so-called breakthrough cases, viral mutation, which leads to higher transmissibility and more severe outcomes, and level of vaccination. And I think that's going to be an important consideration, both driven by both access issues and also by hesitancy issues. Right. I think there's some things we need to stop looking at as risk managers. And I think one of them is case counts. I think the sheer numbers of people being infected with COVID is over time going to be meaningless data, because we're getting into, and we know that vaccines are very effective. There are now certain over-the-counter therapeutics that are coming out that are enabling a good treatment of vaccines. And so really what we're at MEDA, and you'll see when I present sort of how we're approaching it, is we're looking at hospitalizations, or really as a better indicator than sheer case counts. So there's certain things you need to look at, but I also suggest, I think as we get into more the endemic stage, you want to be looking at, not looking so much at case counts, but really looking at when the disease becomes more severe. You're looking at hospitalization rates. So a little bit more information when we talk about, obviously, the reproductive rate. That's the average number of secondary infections. For the seasonal flu, it's around 2. So for every person who gets the flu, they pass it on to other people. The original COVID was around 3. Omicron, the variant that we're all currently struggling with, it's affecting 4 to 8 times people more than the Delta variant. And I think that's really where a lot of the concern around this is, that high degree of reproductive rates. Higher RO, of course, corresponds to greater circulation, all other things being equal. Immunity degradation. Other seasonal coronaviruses that are in circulation appear to cause reinfections about every 3 years. Now, I'm not sure an apples to apple comparison works. COVID is kind of a game changer in many respects, and based on what we've seen with both COVID and Omicron, but I think it's safe to conclude that there will be at least some degrading of immunity annually, and that's something that we'll have to just be mindful of and to watch for and to manage and to monitor through. Viral mutation, the rapid evolution of the spike protein, that's driving increased transmissibility. We've seen that in the Omicron variant. Right? And the last one is vaccine levels. And really, as I talked about, this is going to take the place of both access to both the vaccine, that the vaccine is in the locations in which we're working, and there is the ability of people to actually transport and to administer it. And hesitancy, mistrust of government and or medical systems, as well as misinformation online. I know for us in our operations at MEDA has posed some significant challenges in some of our field offices, even though we have access to vaccines, is getting people to actually uptake those vaccines and to get our staff vaccinated and safeguarding. So what does this mean for us? And Dr. Bradford says, we're likely to experience substantial seasonal COVID circulation. His forecast, and I think just good evidence for this, is about a 20 to 30% of the population will be infected at some level every year. It's often referred to as the attack rate. That's higher than the flu. The flu is about 10%. So it's about a 20 to 30% of the population. That, however, does not necessarily translate into sick people. So we talked about before, COVID effectiveness remains very robust against severe illness. I think we can all be grateful for that. And treatment options are starting to emerge. We're now seeing over-the-counter, easily administered treatment options are now becoming more and more available. Pfizer, just in the last couple of days, released the results on one of theirs that is 91% effective at treating people who are becoming symptomatic, and it's administered again in pill form. The current thinking is that the infection to fatality rate will drop tenfold from what it currently is, from its original 0.6% of people who become severe enough, ill enough that they're symptomatic and requiring medical care, to 0.06. And that's kind of a flu rate. That's sort of a fatality rate of around the flu level. Now, together, I think that suggests that most infections will be relatively mild like the flu, but there'll be enough of it that even a small fraction of severe outcomes are going to add up. So based off all this, what does this mean for us as aid and development, humanitarian, risk management practitioners? I think it's this. One is an understanding that we are going to be managing COVID like every other viral disease from this point forward. I can remember when I would do my briefings, my monthly briefings to our executive leadership team before COVID, there was always a slide on that briefing for disease. because disease is always something we were looking at in our programming locations. It could be malaria in one, dengue in another, yellow fever in another, but disease was always sort of something. So this is just going to be, I think, part of that. So we're going to have to be managing, like every other disease, is be something that we'll have to be mindful of and to manage. I think we're going to find our COVID protocols will transition to becoming part of our regular security protocols. Most organizations, and MEDA is the same, we have security operating protocols that we've used to address a number of mitigations, everything from car accidents to medical incidences to street crimes and those risk factors. And then we've got separate COVID protocols that are designed to protect our staff and our beneficiaries and our partners from the COVID risk. I think over time, and we're actually in the process of starting to do this work at MEDA, we'll be taking those COVID protocols and transitioning them into our SOPs. So you'll see them alongside of, thinking about the safety equipment you put in the vehicles. So right now we have got standard safety equipment around first aid kits and water and tools and to fix a vehicle. We'll probably add to that we'll have access to respirator masks and sanitation and hygiene will be integrated within protocols. How we protect our staff and our clients are going to be integrated to within that. Vaccines with annual boosters, just like the flu vaccine, I think that's going to be something that we'll have to be mindful of. Over-the-counter therapeutics as both treatment and preventative measures, I think are going to be a bit of a game changer in many respects, are going to enable us to be able to respond pretty quickly to outbreaks and be able to manage those. Good safety practices, such as if you're sick, staying home, really emphasizing that, and good environmental controls, masking, improved ventilation, rapid testing. MEDA, back in August, we mandated for all of our locations that we no longer allowed surgical masks or single layer cloth masks. We now insisted that all people who are working for us or coming into our offices have either a ATSM level 3, which is the highest level of a mask under the ATSM you can get, a respirator mask, or a 3-layer cloth mask with a poly filter in that, because we realized that this really is an airborne disease, so we mandated that, and so that's been something that we've put in place. Rapid testing, of course, I think it's going to be important. Improved ventilation, that's something we've been emphasizing at MEDA for a while now, holding outdoor meetings, windows down in the cars, having windows open in our offices. So improving those environmental controls are all going to be part of just the regular day-to-day security management for us. So I think it's interesting is what we've done is, for MEDA, is that we've moved into doing pre-assessments of our operating locations. And I wanted to really sort of show you as a demonstration of how we've taken this information and actioned it. So right now what we do is all of our operating locations, we assess it along 7 indicators. So they're both quantitative risk and qualitative risk. You'll see here we look at the hospitalization percentage of total COVID cases. So 7-day average of COVID-related deaths per 100,000 people is one of the stats we look at, and the percentage of the adult population that is fully vaccinated. So that's sort of, those are 3 quantitative. We've also got qualitative risk measures. We look at the public health measures that are in place, the status of the healthcare systems, how robust they are. We're also looking at NGO staff that are experiencing any harassment or violence that's related to the COVID outbreak. And we also lean and rely heavily on the contextual information of our security focal points, our program managers, and our sources deemed it as credible, relevant to the prevalence of cases. And we take all of that information and we put it into a risk matrix that we update every 2 weeks, because this is such a fast evolving disease and something we just be mindful of. And we take that and we use that information to assess among it's either low, moderate, high, or severe risk. And then we put certain protocols in place. And so what I'll do is I'll tell you about I'll just explain the travel protocols to give you a sense of how we're actually taking this information and acting on it. So we've got low, moderate, high, and severe. So at a low level, if you're assessed at a low level, work or travel can occur and there's really no restrictions in place. And that would be an environment that where COVID, of course, is extremely low. The healthcare systems are robust. All of the measures are in place that enable us to be able to continue and work safely. If it's a moderate risk, we ask that before our staff would be traveling or working in that area, they submit what's called a COVID travel safety review is required. And that is really intended to do 2 things. That's intended to give ownership of their safety to them. So we're saying, we're going to give you the minimum safety requirements. We want you to come back and tell us how you're going to action them. And we also want you to take in, it also ensures that they understand our minimum standards. If you're in a high risk environment, you have to do that travel safety review. Staff member has to do a security briefing and departure, and there will be any additional safety measures that are deemed necessary by the security director, by me, that shall be in place. Severe levels is, we're saying that's an area where the COVID rates and our indicators are so severe that we are not authorizing travel or work in that area unless it's dictated by an emergency crisis. And in that case, there's have to do everything that we've done before, and they also have to get signed off by our global security committee. So our travel process kind of looks like this. Right now, is what we do is we've replaced our previous system that allowed only mission critical essential travel and necessitated approval. So we've eliminated that as of November, and now we have this pre-assessment in place. Those risk assessments approvals are done proactively. The end goal is to minimize the likelihood that the staff or others who engage, who travel on our behalf will contract the virus. Travel, however, for us remains opt-in. So if staff feel uncomfortable with work-related travel, they don't have to go. They work with their managers. And it applies to anyone traveling on our behalf, staff member, intern, volunteer, supporter, or board member has to be followed. And we've also mandated that anybody traveling on our behalf has to be fully immunized with a COVID vaccine. Right. So that's how MEDA is approached. That's what we see in terms of the evolution over the next year, into the next year of the pandemic. Despite the setbacks with Omicron, which are significant, we still think that in the next year it will be transitioning more into an endemic, and will become something that will be sort of ongoing management process. We're not going back to the way things used to be, of course, before, but we will be taking what we've learned about the disease and how to actually effectively mitigate it through ventilation, through proper masking, through really encouraging vaccination, having good campaigns in place, and having access to over-the-counter therapeutics, and really taking it and transitioning into just yet another one of the risks that we will manage on an ongoing basis. That's it for me. Thank you.
Thank you, Scott. I think that was a really comprehensive overview of some of the things that we need to look out for 2022. There is a question that just came into the chat that asks, do you distinguish between which vaccines people have had in overseas locations?
I'm sorry, I'm just going to try to pull up the question so I can see it.
And do you mandate which your national staff can have?
No, we're not mandating right now because of so I answer the first question, or the second question first. We're not mandating. So right now, because of just the vaccine scarcity, if they have access to a vaccine, we really are encouraging them to take it. So we're saying distinguish between the vaccines that people have had in overseas locations. What we're saying right now is it's our approval process is it's either been approved by WHO, by the World Health Organization, or it's been accepted by the country in which they are going to be traveling to. So that's how we're doing it for internationally. For our national staff, because of the vaccine scarcity, we're really just accepting any vaccine that's sort of being rolled out, that's been rolled out by a government. We're encouraging our staff to take it and to get that uptake in that vaccine.
Thanks, Scott. And there is another question that's come in, and I think this one actually could go to others, and we'll get to some more questions in a minute, but I'll go ahead and throw it out there. And then when we get to the wider panel, if anyone wants to chime in, you're welcome to do so. But there was a question around, is there any training developed to equip safety and security focal points to prepare them for the new COVID reality? And as you know, our COVID guidance that you've been hearing about is probably a really good place to go to, but I'll open the floor in case anyone has thoughts or anything on that one.
Well, I'll address the one for the focal points. Yeah, we have protocols in place that set out minimum standards for our offices, our vehicles, any outside activities that we're undertaking, and our security focal points are responsible for managing those. We do that, and we do ongoing training with them. I mean, all of our security focal points come together what we call a summit every 2 months, and we do ongoing virtual training at that point. At this point, that's the extent of what we've done, and we find that's fairly effective in terms of getting them comfortable with the protocols, and also getting comfortable with the risk and how to mitigate it. I'm not sure if any of the other panelists or other attendees have got other points on that.
Thanks, Scott. What we can do is we can come back to that a bit in a few minutes. What I'd like to do, actually, kind of building from that, is to actually go to GISF's COVID-19 videos and kind of just share with you guys, many aid organizations have highlighted the difficulties for managing vaccination requirements and the vaccine hesitancy within their operations. And so therefore, at the request of our GISF members and others from the wider humanitarian community, we have put together some short videos to encourage staff to have the COVID vaccination. The videos capture the personal stories and experiences of aid workers around the world who have received their vaccinations. So do share these. And these videos are not only to inform, but also to encourage staff to get vaccinated. So without further ado, I'm going to hand it over to Megan to share that video.
Buenos días, mi nombre es Adelicia, soy coordinadora de proyectos del Ejército de Salvación, Territorio Norte de Latinoamérica.
Hi there, I am Paula from Brazil and I am with the Salvation Army.
Actualmente me encuentro en las oficinas territoriales acá en San José, Costa Rica, y deseo invitarlos a que se acerquen a los centros de vacunación a obtener su vacuna contra el COVID-19.
COVID-19 is a global problem. The vaccine is the only way that the pandemic is going to come to an end.
I got my COVID vaccine in the end of July. I got Janssen, a single shot, and I was really happy for that. I was really wanting that vaccine. And I just felt a little bit tired for 2 days, and that was it. I was totally fine, and I feel relieved that I got my vaccine.
Al vacunarnos, nos protegemos a nosotros mismos, protegemos a nuestros familiares, compañeros de trabajo y todos los miembros de la comunidad en la que servimos.
If the vaccine is available in your community, get it. This way you will be protecting yourself, your family, your friends, and your community.
Las vacunas actualmente disponibles son efectivas y seguras y nos da la seguridad de poder alcanzar la deseada inmunidad. Bendiciones para todos.
I encourage you, if you didn't have yours yet, please do it. And do it not just for you, for your own protection, but for the people that you love, for everybody else. We need this. So get your vaccine, okay? Bye.
If anyone had any issues with any lags or delays with that, we do, as you've seen in the chat, have them available elsewhere. So you can come to our website and pull them, or we'll share the link in the chat again as well. But do share them, let people know there's other videos in various languages and other contexts also available. We just heard some strange construction noises here, sorry. I'm going to actually go ahead and share for a few minutes a little bit about our COVID benchmarking survey. I'm just gonna pull up slides, bear with me. So as you know, as you may know, GISF has been conducting this ongoing COVID benchmarking survey since about March of earlier this year. And we wanted to give members and also the wider community a chance to share what they're doing with regards to COVID-19. And that, as you'll see, we've pulled the data from various points along the way, and it's kind of shed light to us as the shifts and more information has come out into where people are kind of changing and seeing different dynamic shift with their organizational thinking. So I'm not going to go into the weeds of the full benchmarking, which will be made available soon, but you'll see just a little bit of a taste of it. So if you do have questions, we encourage you to ask them, but we will also have a report that comes out in January. So big thanks to my colleagues, Emily and Camilla, who have really helped kind of pull these resources together. And you'll see some more, like I said, insights into where we are with the benchmarking come January. But to start with here, the first question is, does your organization have a return to office policy or guidance? And perhaps not surprisingly, most do, but if you are one of those that does not, you're not alone. There are still people considering what the return to office policies and guidance are. Has your organization surveyed staff on preferences to return to office strategies? As you see, since we've pulled the data at various intervals, more organizations have trended to actually checking in with their staff as to what their preferences for return to office is. In terms of, the overall portfolio of where people are working and how many offices are currently open, you'll notice that it seems that many more offices have gradually reopened based off the jurisdictional regulations. So I think as vaccinations have been rolled out over the various periods, and as you've seen some more information about ways to prevent COVID-19 transmissions, I think more organizations have tended to open offices with various guidelines. So who are the key decision makers in the return to office plans? I think it's interesting to note here that actually there's been a shift from the responses that were originally received, that more security staff members are engaged in the decision-making process than previous pulls of the data. Is your organization developing a policy around the COVID-19 vaccine? I think this is probably a gold question that a lot of people are very curious about. We will dig into a little bit more of the data when we pull the report out, but just to note that more organizations have shifted a bit from the no or the still considering bucket and seems to be developing yes. So again, we'll dig a little bit more into that, but there are still a number of organizations considering what they're going to do around the vaccine policy. And I think, with the state of Omicron, there's definitely some questions that people are still looking at there. Are you planning to make vaccination a requirement for return to office? So this is similar to the previous question, but quite a few no's in this change, I would say. It seems that organizations are still reflecting on that decision, but of those who have decided, no seems to be the main choice for organizations, not making it a requirement to return to office. But with that question, if you're still considering, or if you've had that, becoming COVID vaccination is now being recommended by most organizations. Doesn't seem like too many have said that they want it to be required, and some are still deciding. But yeah, I think that shows you that hasn't quite shifted too much. It seems to be pretty consistent across the board from March through now. So if yes, still considering on having a vaccine policy guidance, are contingencies being considered for staff who are unwilling or hesitant or unable to take a COVID-19 vaccine. This has definitely, as you can see, seen some shifts along the way, where as more information about the vaccine has been shared, it appears, and again, we'll dig a little bit more in the report, but that some organizations have shifted from still considering to being a no on this. So there's some who are making some considerations, but majority have indicated no in this case. And then, of course, there's still remaining set of group that is still considering. In terms of travel, another important question I think a lot of people are interested in, are you considering vaccination as a requirement for staff travel? Yes, seems to be the overarching theme here, which is great. For organizations that are still considering, there's quite a number that are still making the determinations based off of their organizational needs. And some have decided not to for various reasons as well. And so this next question, if considering vaccination as a requirement, if you're considering vaccination as a requirement, how is your organization planning to accommodate government and other jurisdictional regulations, including financially? So the organizations that have indicated that they plan to make this a requirement, they are planning to cover COVID-19 related costs incurred. Some are still deciding that it'll be dependent on what those costs are, but they are going to cover some, and others are at various points in their decision making around that. So in terms of some of the general responses that we receive, what guidance, if any, are you giving to your country offices who may not have had access to a COVID-19 vaccine for an extended period? Most, as you can imagine, have continued to advise on general COVID-19 safe distance protocols, mask wearing, etc. Others are connecting in with the UN systems. And also worth noting is some have actually reached out to third-party suppliers to accommodate any gaps, and continuing to do work from home or no travel. So there's definitely still different organizations who are addressing this in their own ways. How is your organization addressing vaccine exemptions, such as religious or medical? One way that came up a few times that people have said is they're not making the vaccine compulsory, so they're not seeing this as a challenge for them. And others have said it's going to be individual choice, but others have said it's going to be part of their HR procedures. And I think it's worth noting as well that some have said that these requirements for vaccination are actually going to be put inside job descriptions. So just some quick thoughts for you there. So again, there is still an opportunity for people to add their reflections and thoughts on where your organization is in terms of the COVID-19 planning process, whether you're developing guidance, reopening offices, COVID vaccine requirements, mandates, jurisdictionally, organizationally. We would very much welcome you to continue to update this, and one of my colleagues will put that link in the chat. And we will have the report, as I mentioned, released in January. And if this continues to be a need, then we'll explore other data points to have some reflection on. So that's a little taste of the benchmarking. I will now actually bring the rest of our panel back on, if I can. Hello, everyone. So there were some great questions that have come in from the chat. I would like to just open the floor with, sorry, I'm just going to go back to the question around what resources do you use for tracking healthcare systems, and what types of proof of vaccine do you require for attending offices or travel? And I think that's an interesting question, both for Scott and James in particular, because as COVID-19 passports, digital passports become a thing. So I'm going to leave that to you two to start with, if that sounds good.
Yeah, sounds good. So I'll jump in, and then James, invite you to come in on the digital side. I did put up an answer in the text box, but what I would say is that right now for proof of effectiveness of health systems, it's going to be everything from official studies and databases to anecdotal evidence, and it's really going to vary depending on the location in which you're working. It's a judgment call on the veracity of the information you're getting, and we make it really for every assessment that we do. I will say that I rely heavily upon our program management teams and specifically our security focal points to give me contextual information and knowledge. Our security focal points pre-pandemic, and well, actually to this date, one of their roles is to actually do walk-in assessments of medical clinics in areas in which we work to just get a sense of the facilities that are available to us. And so we want to have a database of facilities for our staff to access to. So it's not unusual for us to go to a security focal point and ask for that information. We provide some guidance, but in a lot of times it really is kind of it's a bit of a judgment call in terms of looking at the information and how much weight you're going to give to it. On the vaccine or on the proof of vaccination, at this point right now, we're taking whatever is administered, whatever's issued by the public health authority that is providing the vaccine. I think as we get more into embedding these as part of our regular systems, we will have sort of some checks and balances in place to make sure that we're not getting forged documents or items like that. But honestly, right now, it's not anything we're looking at. Right now, we're pushing getting our staff vaccinated and getting that proof of vaccination in. So we take whatever the public health authority has issued, and we're looking at that. It'll be something that as we becomes more embedded in our systems, we'll take a look at. Right. James, over to you for any comments on your side.
Yeah, I mean, it's a little bit difficult here, especially in the digital parameters. So I know some organizations have actually started, even if staff don't want to get vaccinated, their vaccine hesitancy, or they've got some other kind of objection to it, what they have implemented is lateral flow testing on a weekly basis or ahead of field trips out to communities where there's some sort of community mobilization. And then what they're doing is trying to set up some sort of database system where everybody's lateral flow test is then recorded. And over time, you can build a bit of a database about how many staff are being infected, how many staff are testing positive, how many false positives you're getting, and kind of tracking things that way. It works, and it also overcomes the vaccine hesitancy. And then you can tie it also into how many staff are vaccinated versus unvaccinated, and then the lateral flow test results. And that kind of builds a picture of your organization. So it's using a digital sort of system to check on something that is a very practical non-digital test. But on the passport thing, yeah, it really depends on the jurisdiction. I mean, in some jurisdictions, there's going to be a lot of checks and balances around, whether you're getting a current code or something on your phone that you can show to access a venue. We know just recently in the UK that someone tried, just to test the system, to use an expired COVID PCR test result to try and book something like 15 flights through Heathrow at Gatwick. And each time nobody bothered to check whether the test result was current and still valid. And so even in modern economies, we're having a problem. There were stories out just last week around Nigeria. You could freely buy a COVID certificate for travel online. There was no real requirement other than you paid somebody a fee to forge you a document. So that kind of thing is going to be increasingly common. So I think for organizations, you really have to kind of look at the practical things that you can do, like the lateral flow testing. It's quite cheap. You can provide all your officers with lateral flow test kits. You can have someone actually supervise someone taking the test once a week, take a photograph of the result, put it into the database, and then combine that with sort of linking in with the local health authority, whatever system you're using, and trying to do a judgment call based on how accurate and reliable those kind of systems are going to be. That would be my thoughts on it.
Thanks, James and Scott, for that. I am actually going to go to Adelicia for a question. You mentioned that there were statistics showing perpetrators of incidents against aid workers have increased by civilians. Is there any information about why this is the case? And is it directly linked to COVID, or, you know, was it increasing in any way?
The data on this isn't really robust yet. So the best data out there, from what I can tell about COVID-related risks, aside from what every organization themselves is collecting on security incidents, is the data that Insecurity Insight has been collecting on this. To be honest, the information is broadly on health workers, and a lot of the examples are about fears of, you know, ambulance drivers bringing COVID back into the neighborhood, fears about bodies being buried near residential areas and whether that can spread. So it's really stems from fear. And we've seen this also from better studied responses to Ebola in Western Central Africa, to Ebola in the Eastern DRC. It's a novel virus. It's something new. There is a proliferation of information. Nobody knows what information they can trust. So it stems from that fear. But I think in terms of security risks, the biggest risk that COVID poses is that impact that not COVID itself, but the structural changes that come with COVID. So the new regulations, the government lockdowns, the enforcement by police and military, sometimes incredibly brutal, and how that changes the context. The biggest example I would say is Ethiopia at the moment, where they think, a lot of people think that the pandemic actually triggered a lot of the violence with unrest and demonstrations. And now we have a really horrible situation that's affecting aid workers, you know, very strongly. There are solutions, obviously, about acceptance and working with communities, but we also have to be aware of the structural impact, and not to think of COVID only as a disease, but to consider all the impact it has on other aspects of it and how that can affect communities as well.
Thank you, Adelicia, for that. There's another question here that's interesting that I'd like to ask. You know, how do you balance the duty of care to different staff and confidentiality of medical information if some staff are not getting vaccinated and have chosen not to disclose that? I'll leave that to anyone to answer.
Well, it's kind of, go back to things like malaria, or I don't know, if you're going to travel to a certain area or you're going to work in a certain program in a certain context, you know, it's a requirement of the organization to understand that you are taking antimalarials, or that you're vaccinated against cholera or typhoid. To be honest, disclosing that I don't see as a violation of your confidentiality of your medical records. That should be open source information, really. But that is going to depend on jurisdictions. I mean, different places are going to look at it differently. Different labor practices and labor codes are going to look at it differently. GDPR would probably, depending on how the information is being used and recorded and stored, would probably have an influence on it. So it just becomes part of this complex sort of system. Now, I know when I first came to the UK and took a job with Christian Aid, in my HR application and all the data I had to fill out once they'd offered me the job, was a question about my sexual orientation, which I thought, in where I came from, you didn't ask those kind of questions, but that's an HR requirement in the UK, and it's okay to ask that kind of question. I don't think it's inappropriate to ask that question. If someone doesn't want to provide that information, I think that would probably have to trigger some kind of a result for organization, because we aren't in the business of serving ourselves. We serve communities, and we have a duty of care and a do no harm philosophy in those communities. And so I think there's a practical side to it as well.
Yeah, we just rolled out at MEDA, and it's for our North American offices, but it'll be a template for our other locations. That staff coming into our offices either have to provide proof of vaccination, or they have to provide us a rapid antigen test that day before they come in. That's administered by our human capital office. So they're the ones who administer it. There is issues of confidentiality around it. And we worked with a couple of lawyers to come up with the wording that would be appropriate. But for us, the legal department felt that met sort of our standard. And we're going to use that as a template as we roll forward. We're not going to make proof of vaccination mandatory in our field offices until we've got good vaccine access, equitable access. But once we do, that is the plan going forward, is that we'd have the same standard. It would be proof of vaccination. That's our preference. But if you don't want to prefer it, you need to give us a rapid test that day coming in. And the next question for us is who's going to pay for that? Right now we get them free from the government, but that's going to stop eventually. We need to make a decision how we administer that, but that's for another day. That's how we're doing it right now.
Thanks to you both. Any other thoughts that you wish to share or leave with us as we approach the hour? Any thoughts from you all that you'd like to leave us with today? Yeah.
I would just maybe point to the fact that vaccine hesitancy isn't that bad in a lot of the countries that we work in, at least according to the data. It's actually quite high. It's just that there aren't any vaccines to go around, and it can also be the type of vaccine that's being offered causing concern. So very famously, I think it was the Congolese president who refused AstraZeneca and waited months until he was offered the Pfizer, and that message that then gets passed down, it is something that needs to be considered. And so in terms of vaccine hesitancy, it's also about providing that space to ask questions, to address concerns among staff, but also among community members. A lot of public health messaging is very one way, wear a mask, get vaccinated, maintain your social distancing, without a space to say, well, that doesn't work in real life. I still have to go out. I have to drive my taxi if I want to feed my children. So how can I find a compromise? I think that also holds among staff as well. So just to, I'm sure that this is already happening in a lot of organizations, but to provide that platform to address those concerns and maybe change the way the organization is approaching its requirements to match those concerns.
Thanks, Adelicia. Anyone else?
I just wanted to say it's a brilliant guide. I'm really glad that GISF has put this together. Even listening to Scott and Adelicia, I just started making notes on the sides of things I need to be doing for my organization. And I'm assuming the people that are attending are probably doing the same thing. So yeah, just big thanks. And if anyone has any questions for me later on, fire me an email.
Amazing. Scott, anything before I?
No, I would echo that. And the issue of vaccine hesitancy too. What we've often found too is a couple of our field offices, and we have really good security focal points, and who really take their jobs quite seriously. And a couple of our offices, our security focal points have gone out and have identified within the workplaces local champions, people who are informal leaders who have gotten vaccinated, who will now have those conversations with staff who are perhaps hesitant to encourage that uptake, but getting that local contextual information and then adjusting your protocols appropriately, I think really are important. It's important from an acceptance perspective, and I think it's important too from just equity between global north and global south, and giving some autonomy to our local staff. That's worked really well for us. So I would echo the same as with James. I've been furiously taking notes, learning from the other presenters, and I look forward to continuing to work. Don't hesitate to reach out if I can provide any templates or samples or any further information. Right, and thank you so much to GISF for this opportunity.
Well, thank you, all of you. Each of you have shared such really helpful and informative things for us to walk away with, as you've said. I'm going to go ahead and ask my colleagues to launch the poll just to get a sense of how you guys found today, but really appreciate you all and the time and energy and information you've shared with us, and for all the work on the COVID modules and the information that you're cross-sharing to help make our sector a bit more safe. So with that, we'll leave the poll open for a few minutes and let people respond. But we want to say thank you again for tuning in to us and joining us, and thank our presenters. And we look forward to seeing you at the next GISF event. Have a wonderful day wherever you might be.
Thank you very much, everyone.
The people doing the world's most important work are up against the biggest challenges. Since the 90s, security incidents involving NGOs have increased as their independence and impartiality no longer protect them. Humanitarians are actively targeted, as well as exposed to the risks of conflict and disaster, facing kidnapping, injury, and death in order to help those in need. And the threats to their safety means their ability to help diminishes too. NGOs began to create roles for dedicated security professionals, but they often lacked support and resources and worked in isolation. In 2006, a group of them from the UK and Ireland got together to develop coherent approaches to security risk management in the humanitarian space, eventually becoming an established network, the European Interagency Security Forum. With a strategic, inclusive, and collaborative focus, the forum has created a center of excellence, facilitates a peer-to-peer network, builds capacity for security risk management, and provides a voice for practitioners, reaching over 100 members. In response to growing demand, it has now gone global, bringing different perspectives, expertise, and resources to make core activities such as original research, trainings, workshops, and knowledge sharing more impactful than ever. As a result, organizations are able to build their security risk management on an even stronger foundation to keep more aid workers safe and enable sustainable access to communities in need. With a vision to see the work of the whole third sector done more effectively by supporting NGOs around the world, we are the Global Interagency Security Forum.